Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang-Sharp, IBCLC Director of Communications and one of the MCs here at Gold Midwifery. That's right, we're talking all about our Gold Midwifery Conference, which is coming up really soon, February 5th. For most of you, check out all the details online at goldmidwifery.com. There you'll find all the dates, all our speakers, the abstracts, the outlines, the topics, oh my goodness, and so much more. Be sure to join us for our opening keynote with Augustine Colbrook, who will be a free and open access presentation. So you have lots of opportunity to do some great learning ahead of time of all the main conference. You can register for that right now, as I mentioned. So just head over to the website. It's really good when you register your seat. It means you'll get all the updates of what's coming up in your email and make sure that you can come on time. Now, being part of the live event is really important. It means you could engage with all the speakers, the other participants, but we do understand that some of you will be busy on those days. Perhaps you'll even be in the clinic or at a birth, which is so exciting. So just know that all the event will be recorded for your convenience. You can come back and listen to it at your convenience. Now, let's get on and talk to our very special guest today. I have to say, and a friend of mine as well, Dr. Manisha Gogri, thank you so much for joining me here today. We're so excited to have you at the live event.
Thank you so much, Fiona. I'm so excited too. This is my first time at Gold Midwifery Conference.
Yes, and I am so excited because we talked about having you come on board and do a live event because you are just such a wonderful, and I feel like you have just been growing in your experience over the years. I tell you, you're a very special woman because you are so passionate the way that you speak to your clients. I see you on your social media posts, but we also had you last year. We captured you to come and do a networking session for us, which was wonderful, which gave us an opportunity to sit down, work together. And so I'm delighted that you're back here talking about a really important topic, which is going to be prenatal assessment for early detection and prevention of potential breastfeeding challenges, because we all know that prevention is really the key. I'm always talking about it. Please come and see us prenatally so that we can help you. And of course, you'll be part of our main conference event. So we'll talk about the topic in just a minute. We know it's a big one and it's a juicy one, but why don't you tell folks what you do and where you are in the world?
So I am from Mumbai in India, and it is now the most populated country in the world, as everyone
Oh,
knows.
yes.
So the number of births that happen and the constant need that we have for good midwives and childbirth professionals, lactation consultants, it's just mind-boggling. It's just, we can just never do enough.
Right.
So, my journey actually started with medicine. So, I am a doctor,
Hmm.
and somehow life took its turn, and I diverted towards, something attracted me, especially after my own birth, to learning about more about childbirth education and working with young couples. And as it was really an eye opener because in a big metro city like Mumbai, there were hardly any childbirth education classes. So
Wow.
mine was probably one of the first ones to
Hmm.
start the constructed program that I started for couples. And my journey into lactation, because today's topic is about lactation, also began through that because I would be dealing with couples antenatally, and those same couples started coming to me postnatally, and
Right.
their journey versus the people who had not received any education. It was
Yep.
like dramatically different, is what I started seeing.
Hmm.
And I trained to become a Malaysia League leader again, the second in my country. I
Wow.
started conducting meetings for, again, young parents. And that was my learning, actually. I
Mm.
learned as much from them as they learned from me.
Hmm.
And I, we didn't even know that there was something called IBCLC. We didn't have IBCLCs in the country at that time. And
Right.
one international conference that I attended, like it was an eye opener. This is something that I want to do. So studied for IBCLC with a group of colleagues who were all
Mm-hmm.
working in the field of lactation, became, among the first IBCLCs in my country again.
Yes.
And yes, and because of my background in antenatal, so this is, why this topic is so close to my heart.
Mm-hmm.
I would focus a lot on going to obstetricians, gynec, telling them I want to have these couples before they don't call me after they have
Yes.
lactation problems.
Yes.
Just I want to have them in my classes before. So trying to promote that again in my own small world,
Mm-hmm.
there is a lot more to do. And I mean, before you ask me, this was like in short about my journey and my field. So today I have my own lactation clinic where I'm sitting right now. And yes, I train other professionals to become IBCLCs. I work with patients here and all across the country, because thanks to virtual counseling now, virtual consults now, and also reach out to so many parents across the world.
Oh, amazing. I just, what a beautiful journey for you. I know the work that you're doing. I know how passionate you are. And as I said, we sort of align, our work, is very
Mhm.
similar across all the
Yes,
different nations, but very inspiring to hear your story. Thank you so much for
thank
sharing.
you. Mm,
Yeah, so let's dive into the topic. Because
mm,
this is, like you said, it's a big one. And I know you notice the same things that I do. And it is really tricky to convince, some of our clients that, coming to get this education, there's been a drop off. COVID didn't help at all with,
mm.
classes and, acquiring some of that education. We do see, I feel, quite a few of our second time, third time parents come to us, because
Okay.
they recognize some of the things, some of the challenges that they faced. But
Agree.
tell me,
Mm.
from your point of view, let's talk about, really the key to prevention. Does it in fact really support the case for, preventing challenges down the road?
100%. I totally believe in it because, see, we all know as professionals, some problems that occur after birth are sometimes, you cannot really predict them. They are unpredictable. However, largely, if the parents have had an education in, the basics, at the least, they can recognize that this doesn't seem right, and I need to seek help. If even if these are the only two messages that we can pass through, that will also save so many breastfeeding journeys from being like prematurely terminated, which unfortunately does happen. Even when help is available, they don't know that help is available, or they don't know that something is going wrong, and it is only when pain starts or the baby starts losing weight, they happen to go to someone who may or may not be in a position to help them. So as much important it is to recognize problems, it is also important to know the right people that you should be seeking help from. So these are some of the messages that we want to convey in the hospitals to their primary healthcare providers, that at
Yeah.
least yeah, spread these messages that they need antenatal counseling, they need to go to the right person if problem occurs after birth.
Yeah, absolutely. And we've seen it over and over again, just the way that it improves the outcomes, with even, from initiation, but the outcomes in terms of how many families are still breastfeeding at that, 2 week, 6 week, and then 6 month marker. Like
Months.
these are huge
Yes.
disparities that we're seeing. And the interventions that may be required in order to get them there. The two groups are startling difference. One of the key
Yeah.
things, though, Manisha, I don't know if you found the same thing, but once our families have a connection with us, if they've met with us before, even if it's for a short time, they feel
Yes.
so much more confident about reaching out afterwards. That the connection is really the key, to them. Is that something you found as well?
Yes, yes, I have. So, very typically, even when I was not into lactation as a profession, people attending your childbirth classes also want to come back to you to seek advice. Even if their doctor tells them something, they would come back to you and check with you. So if you have developed that kind of a rapport with them, it just stays and they always come back to seek more help.
Yeah, absolutely. This is going to be such a good topic. I think just understanding the nuance, some nuanced behavior, some startling statistics between the two groups, making sure that we really can cover some of those really key history components as well, in a
Yes.
family is just going to be
Mm.
vital for,
Mm.
this sort of really looking at this as a case study, because that's, really what we've seen is over and over again, this repeated behavior. So thank you so much for joining me here today. It's been absolutely wonderful having you. I'm looking forward to seeing you at the live event. A great opportunity. We're going to come together. We're going to have an opportunity to ask questions again of Manisha, right? We're
Yes.
ready.
Yes.
And of course, we'll have a live Q&A where we can jump in and just really share some of our experiences around the world, and some of the challenges that we face with our families today. So thank you so much once again for joining me here today. You can join us over on the website as well. Check out all the details at goldmidwifery.com. Thank you so much, Manisha. Have a wonderful
Thank you. Thank you,
rest of your
Fiona.
day. Yeah. Bye-bye,
Yes.
everyone.